Welcome back to the today's session. Today's session will be taken by Dr. Indu OS ma'am, from the assistant professor from the Alvas Homeopathy Medical College, Mudubidri. So ma'am will be taking the topic which is of today's need of our guidelines for the synopsis writing. We welcome you all. We welcome all the participants. We welcome you, ma'am. Session is all yours, ma'am. Thank you.
Okay, thank you, Dr. Lavanya. So, as you all know, today, sorry for getting delayed, and today's topic is guidelines for synopsis writing. Okay, or from ideas how we can create a synopsis or how we can frame or draft a synopsis, and what all content should be there in a synopsis, and all particulars related to the synopsis writings. Today, we'll discuss all these aspects. So this session is mainly for the beginners or the BHMS students, especially for BHMS students who are applying for the research grants as well as scholarships under CCRH and all. Okay, so let's see. Yeah, please keep it in the slideshow mode, sir. Excuse me, sir. Could you please keep it in slideshow mode? Slideshow, sir. You can, yeah. So, actually, what is the need for understanding the guidelines, or what is the importance of following the guidelines to write a synopsis? That is very important. So, if we are understanding the importance of synopsis and the contents of synopsis, then it will really help you to improve the quality of your research work as well as your publication. So all these things are related to the preliminary, the very preliminary step, that is synopsis writing. So the objective of this particular guidelines for synopsis, and why we should know the guidelines of synopsis writing, that is to improve the quality of your synopsis submission. So next slide, sir. So most of the times, you majority of us may faced the incidents like rejection of our synopsis. We might be working hard for the submission as well as for the pre uh, planning for all these kind of stuff related to the research work, but still we may get rejected after the submission, or else if you are submitting the synopsis and it will get accepted, but after submitting the final report again it got rejected. So why it is happened? So we may think about this. So most probably that is maybe due to the errors in writing a report or writing a synopsis. So the synopsis, as you all know, it is a gist of the things what you are supposed to do or what you are planning to do. All these things we are mentioning under the synopsis under different headings, like structured synopsis we'll make, right? So anyway, this synopsis guidelines, or how to write a synopsis or how to frame a synopsis, all these guidelines will improve the quality of your synopsis submission, as well as it will improve your knowledge related to the synopsis writing. So, what all things should be there in synopsis? Next slide. So, what are the contents of synopsis? You should know what all things should be added. So, as per different universities, maybe the synopsis format or the pro forma may be differed. But in general, if you see, one common format is there for synopsis writing. So in next slide, you can see the contents of synopsis. What all things should be there in the synopsis? So these headings you have to be very careful. So what is synopsis? As I said, it's a complete and detailed explanation, right? So it's a complete as well as a detailed explanation of what exactly the particular research will be about or the experiment will be about, and it includes what all or which all materials will be used, and it how it will be conducted and evaluated. So this thing we'll discuss under materials and methods. Okay, materials and methods. So this is also one of the important headings or the contents. Then Transparency in techniques as well as methods and data evaluation. It will enable the readers to understand and the scientists to replicate the experiment. So before going into the synopsis and its contents, first of all, you should design your study or you should design your research. So the designing a research or study depends upon um, the type of study what you want, as well as a sample selection and sampling method. All those things are very very important. So as per the sampling technique and sample size, as well as the type of the research what you want to do, like different researches are there, right? Experimental research, observational research. Then as per the type of research, we have to design or frame the study. So that is very important. So if once we fix or once we finalize the design of the study, then only we can go for the techniques as well as materials or methods. So as per the study design, we have to opt for the appropriate methodology as well as appropriate evaluating methods or assessment criteria. So all these are depending upon the study design. Designs, prospective studies are the retrospective studies, case control studies, cohort studies, longitudinal studies, then these kind of clinical studies like a drug proving and effectiveness of a drug in particular disease. These are the different types of study. So this study design as well as the methodology may vary according to the study design. That is very important. So designing a study gives more importance and more value to the research what you are conducting. So next slide please. So while this is mainly for the beginners, that is typography details. So you should know what is a font size and font style you have to choose while writing a synopsis. So as you all know, all official, all those things we'll write in our dissertation, even if it is synopsis also, we'll choose this Times New Roman style. And this font size should be 40 and bold for the heading, and 12 and bold for subheading, and 12 for body of the text or the content. So this is the universal format for a synopsis, or else for the dissertation also you can follow the same typography details. So we have to give a double line spacing as well as pagination for of all the pages. All these are the basic requirements as well as the guidelines you have to follow while writing the synopsis. As well as for dissertation or thesis also, you can follow the same font size and font style. Okay, so it should be a Times New Roman. And you have to be very careful while writing a synopsis. Don't use italics as well as underline. Don't use underline in headings as well as in the content of the synopsis. So that's why for subheading, you can use the font size 12 as well as bold. So it will differentiate the main heading of 14 size from the subheading of 12 size. So like that, in this way, we can differentiate the heading and subheading. Please don't use the underline anywhere in this synopsis content as well as in the title pages. Then next is the main important part of this particular webinar, that is contents of synopsis. So next slide we'll see the contents of synopsis. So while writing a synopsis, majority of us will be having a doubt while writing a synopsis, what all content should be there in a synopsis, or how can I frame a synopsis. So next slide please. You can see the contents. Okay, so as you know, the first content should be the title, right? Next slide. The slide is not moving, I think. So next slide, you can see title, and the title should be followed by introduction. Slide is not changed. So title, after title, see title, how we can frame a title means that is again an important concern of every researcher. So when we plan the research design or study design, and then after study design, we have to opt a appropriate methodology. Then we have to fix what should be the outcome we have to assess. After all these finalization, we can give the proper title. So title, sometimes we can't able to give the title at the beginning, but only after preparing the synopsis at the end only we'll get the good appropriate title for your entire study. So title is the first content of your synopsis, and next would be the introduction. So introduction means you are introducing your research topic to the public, right? Or to the community. So introduction should include the need for the study. What is the need of this particular study, or what is the relevance of this study? It should be there in the introduction. Mm. So introduction should introduce your topic to the public, as well as what is the importance of taking up this research, and what is the need for the study and relevance of this particular study at this moment. That should be there in the introduction. Excuse me, please change the slide. You can see that next slide. All these contents are mentioned in the next slide. Yeah, thank you. So title, introduction, then review of literature. So in review of literature, most of the times the students will be confused with the review of literature. Why? Because we can see that in during the internship program, interns are used to prepare this dissertation work as part of their curriculum. So in that you can see that under review of literature, most of the students have written about suppose if it is a clinical condition, they used to mention about the from anatomy till the investigation as well as general management of that particular disease condition or clinical condition. So it's not like that. The review of literature should be, it should contain the details of your topic and what all researchers happened in the area of your topic from last few years to the present moment. It should include all the relevant available data about your research topic or your research question. It's not like anatomy, physiology, pathophysiology, or else signs and symptoms investigation. It's not like that. Review of literature, it doesn't mean the anatomy, physiology, signs and symptoms, etc., etc. It should include the the gap, the research gap. What is the uh, see? Some researchers, if you see some papers or some publications, you can see that limitations of that particular study. Okay, so you can take up that limitation and what they uh, suggest, what the author suggested to fill that research gap of their study. Maybe they can suggest a large sample size or a comparative study. So those things they suggested as they mentioned as limitations of their study. They didn't get any comparative group, or they didn't do a comparative study, and they couldn't do it in a large number of sample or large population. All those things they considered as their limitations of their study. So those limitations you can take up and you can make a research question out of that limitation, and you can frame it as a different study. You can continue with that study. That is also possible. So from where you will get all those things means after reviewing different literatures. So you will be having different search engines like Google Scholar, PubMed, Cochrane Library. All those things are the research engines. So in that you will get a full details of your topic. If you search like search words, no search words like if you are taking, suppose if you are taking a clinical study like effectiveness of our individualized homeopathic medicines in the management of simple myopia. It's a topic, right? It's a title. You can say it as a topic. So you have to search literature related to your topic. That is, your topic is simple myopia, and your intervention here is individualized homeopathic medicine. You are not checking the action of any particular medicine. You are checking action of individualized homeopathic medicines or personalized medicine, right? So how you can search means you can type the word simple myopia, then you can type and in capital and in full capital, then individualized homeopathic medicine. Then you will get the literatures which include these two words, as you mentioned, and in between these two keywords. Or else, if you type like this, simple myopia or individualized homeopathic medicine, then you will get articles either with simple myopia or with individualized homeopathic medicine. This is the way to search for your research topics or research papers related with your topic. Okay, so review of literature means the researches happened in your research area or your topic on your topic since a few years till now. So till to date, what all updations happened or what all researches happened in your topic, those areas, those points you have to refer and write the review of literature. Okay, I hope it is clear. So next heading is objectives of study. So under objectives, you can mention your prime aim as well as the secondary aim, like that is objectives. So the one thing you have to be very careful about framing objective, that is, while framing objectives, suppose you are framing three objectives. So while framing three objectives, you should include three results in the result section in your dissertation. Okay, this is synopsis. In synopsis, we will not get the result heading because synopsis is the it is a uh, future of your study, right? You didn't do it, you are going to do it, so it's your plan, it's your planning actually. So in that results we can't accommodate, right? So if you are preparing the objectives and you just see how many objectives you prepared, so as per the number of objectives, what all things you mentioned under objectives, all these things should be addressed under the result, either in the form of table or figures, whatever it may be. Whatever objectives you set, all those things should be answered in the results, right? That is the important thing you have to see. The objectives and results should match. Then next is materials and methods, and last one is bibliography. So materials and methods includes the sampling techniques, sampling this what methods you are going to adopt for this particular study. So a standard methodology you have to adopt for your study. So mainly while we are sending the student research proposal for STSH or any university grant, if it is rejected, means the methodology was not proper. That is the main reason for rejection. So that's why you have to follow a standard methodology or standard protocol for your particular research. So you can like this review of literature, while reviewing the literature related to your research, you may be getting so many methodology as well as materials for conducting this kind of studies. So if it is published in an authentic publication or journal, you can take it this particular methodology as a reference for your study. The only thing is you have to uh, give a reference, or you have to uh, um, what under bibliography or in the text, you have to give the reference for that particular article or journal from where you have taken the methodology for your research. That is the only thing you have to be careful about the methodology if you are taking it from any other journal, other standard journals. Okay, so these are the 6 contents of your synopsis. Then we can see each one in detail. Okay, so title, as I mentioned, title should be the aim and objectives. Okay, so the from your aim and objectives, we can frame a title. So suppose, as I mentioned earlier, the topic effectiveness of individualized homeopathic medicine in the management of simple myopia. So obviously we'll see the effectiveness of individualized medicine. Okay, that is one of the objectives. Then second objective can be which medicine will be more effective. Okay, so one more important thing I want to mention here is while writing synopsis you have to use the future tense. Okay, that is the cases will be analyzed or the medicine will be administered, like that future tense you have to use. But writing dissertation means you have to follow the past tense because you have already done with the study or the research, and you are writing it, you should write it in the past tense if it is a dissertation or thesis. But if you are writing synopsis means it's you are planning only, so you have to follow the future tense. So don't make mistake in this tense also. Okay, so most of the times while writing final report also these students will copy and paste the synopsis directly to the dissertation, so this mistake can happen. So just to avoid this mistake, you just please read and copy, then you edit it in that. Okay, so the synopsis should be in the future tense and dissertation or the report should be in the past tense. Okay, so this title should indicate what the synopsis is about and to catch the interest of the reader, and it should be catchy. So title should be a catchy one, and it should generate the interest in the reader or the researcher who is reading this particular synopsis, and it should be an impressive title. That's all. Okay, so it should include the exact name or a description of the test system as well as what type of intervention you are doing. So, as I mentioned, you can see that this is a formula, PICO. Okay, so this PICO should be there in your title. So, P stands for population, I for intervention, C for comparison, and O for outcome. So, let me explain what all these things. Population means your study population. Suppose if I mention one topic, right? Effectiveness of medicine, homeopathic medicine in simple myopia. But here I didn't mention about the population, right? So it's not following the PICO standards, right? So you can modify the particular topic like this: effectiveness of individualized homeopathic medicine in the treatment of simple myopia among the children of 5 to 15 years of age group. So here it is clear that you have mentioned about the population. Then intervention means intervention what you are giving here is individualized homeopathic medicine. So it is already mentioned. Then comparison. So here we are not having any comparison group. What I mentioned, no, in that title there is no comparison group, right? So if you are doing a clinical research, try to get a comparison group. Otherwise, this clinical study will not be a valid one. So whenever you are doing a clinical study, it should be a comparison group. You can compare either with the placebo, but CCRH nowadays they are not promoting placebo control studies. Why? Because it's a ethical issue from the part of the patient. If as we are denying the treatment for the patient, no, it will be considered like that only. So as per the disease or according to the disease prognosis, we can fix whether it is whether we can manage with placebo or we should give any medicine. Like that we can fix as per the condition of the patient or prognosis of the particular disease which is taken for the research. So uh, try to avoid the placebo comparison, okay, in this kind of clinical studies like effectiveness studies. So you can compare with this individualized homeopathic medicine, you can compare with a specific remedy or a clinically proven remedy, or with the this sector totality you can arrive at a what we will say one this kind of short acting remedies or any specific remedies. You can compare with a specific remedy, or else you can compare with a tincture with any potencies of the particular medicine. So or you can compare with any other system of medicine or treatment, like individualized homeopathic medicine and lifestyle modification you can compare, or with yoga you can compare, ayurveda you can compare, or as an add-on you can compare. Okay, so all those are the possibilities to compare your research. Then outcome means outcome you have to mention. So effectiveness of this thing in management of simple myopia in terms of uh, reducing the visual acuity, or we can use any other symptom scoring, or else any scale you can use, any assessment criteria you can make it as an outcome. Okay, or retroscopic value, anything you can make as an outcome. So like that, your title should contain these four elements like population, intervention, comparison, and outcome. This is the minimum requirements for your title. Next is, while using title, you try to use the action verbs like to determine, to compare, to verify, to calculate, like that. Okay, so this is mainly for your objectives or aims. So in objectives and this aims, you can use like to determine whether daily, one example I can give you, like to determine whether daily oral regimen of this IFA tablets is better than weekly oral regimen in treating anemia. Okay, anemia among women in reproductive age group. So this thing we can um, take as example. Okay, so while preparing title, your title should be a very short and precise, and it should like a mini skirt. Some people used to call it as mini skirt. Mini skirt means it should be a short, but it should include all the elements, right? So like that, you have to prepare a catchy title which should include the elements PICO. Okay, population, intervention, then comparison. Last one is outcome. So the minimum requirements are these four elements. Then next comes the introduction. As I mentioned, need for the study you should mention. So in that you can introduce your hypothesis by explaining the relevance of your topic, as well as the disease which is considered for your study, as well as the intervention which is considered. So as I mentioned, simple myopia. Simple myopia, the only management is surgery, as well as this particular glass or spectacles, right? So majority of the population affected with the simple myopia may refuse to use the spectacles for daily use. So only option is surgery. So surgery may be costly and everyone can't afford it. So that is the importance of this particular topic at this present scenario. And why homeopathy is effective means we have to give the justification for the particular intervention what we are using. Okay, so that is coming under the need for the study. So next comes review of literature. Review of literature means the background of your research or the background of your selected topic. So this review of literature should give a general idea about your topic, um, uh, as well as the publication details about the topic, specific topic, to the readers. So we have to cite the scientific literature. We have to give scientific evidences in this particular field of your study, your specific study, as well as the previous work on the subject to document the relevance of your topic. Okay, so we have to justify our topic with the previous document or previous evidences or previous works happened in the same field. Then we have to give the sufficient information on what was going on before this particular research question came up. So when a research starts, actually, so when a research starts means when we are arising a question, then only a research starts. See, when while we are doing our BHMS, we'll be having lot of doubts, how this medicine is acting, how this potentization helps to increase the particular innate energy of a normal substance. All those things will be there in our mind, and if we are thinking and if we are questioning all those things, then we will be having the tendency to try those things also. So that's why first we will set a research question, then we will set some hypothesis. Hypothesis means all our assumptions only. Suppose if we are comparing two treatment methodology for diabetes, as diabetes is a lifestyle disease, we can compare diabetes with the homeopathic medicine as well as with lifestyle modification. Suppose it's a topic. So what we can do in this means, while we are comparing these two, we'll make some hypothesis. We'll be having one research question like homeopathic medicine is more effective than lifestyle modification in the management of diabetes mellitus or diabetes mellitus type 2. If we frame a research question like this, out of this research question we have to frame the hypothesis. So you may be studied in this community medicine, like a hypothesis, null hypothesis, as well as alternate hypothesis. So how we can make a null hypothesis means, our research question is whether our homeopathic medicine is more effective, right? So we are assuming that homeopathic medicine is more effective than this one, what, lifestyle modification in managing the diabetes mellitus type 2. We are assuming that is our alternate hypothesis. Homeopathic medicine is effective, so that is the alternate hypothesis. So null hypothesis means homeopathic treatment or homeopathic medicine is not more effective than lifestyle modification. So we have to test the hypothesis. First we have to test the null hypothesis, and as per the statistical analysis we are arriving at a conclusion whether this null hypothesis, whether we have to accept it or reject it. Okay, so first of all we have to set a research question. So every enthusiastic researcher will make a research question at his mind, or her mind. Then we will frame some exceptions out of this research question, that is known as hypothesis, and testing hypothesis with appropriate statistical tool or statistical test. Okay, so this statistical test, how we'll consider the statistical test or select the statistical test means, after framing the research design, no, I told, no, we have to frame or we have to design the study, then we have to find the methodology, then we'll calculate the sample size and the sampling technique. Out of this we have to, or we will come to the conclusion of which statistical test I have to do. If it is a comparison and only less number of samples, it will be different from a sample with a large number of samples. Okay, so as per the sample size, as per the type of study, we have to opt the
Ma'am,
appropriate
sorry to interrupt,
statistical.
ma'am.
uh,
Actually, is the slide, it is the relevant slide, ma'am, or else can we have to change the slide, ma'am?
it's okay, it's okay. Review of
Is
literature,
it,
yeah, it's okay.
uh,
I was continuing with the this one, no topic. So it's okay, because
we thought,
research it's okay, it's okay. I'll tell if it is not relevant to the topic. Okay.
okay, ma'am. Thank you, ma'am. Okay.
So like that we have to we should give sufficient information on your uh, this one, what, your particular study, specific study field, with the research, how you came into this particular research question. So that's why framing a research question is very important. It should be a relevant one, and it should be a appropriate one to your appropriate to your study area. So why this particular experimental model and main parameters were chosen? All these things should be answered, or you should give information regarding all these three. Like what was going on before this particular research question came up. So what is the present scenario of your topic, and why this particular experimental model I have chosen, as well as why these parameters. So we'll see, while we are taking a clinical study, we'll fix some parameters. If you are doing a research in iron deficiency anemia, definitely you should make one objective parameter, that is serum ferritin. So we'll see the changes in the serum ferritin level before and after your medicine, right? So we have to fix some parameters and what changes are happening in that particular parameter. So why you have chosen this parameter should be there in your review of literature, and why they are adequate for answering the research question. All those things will be addressed in the, or should be addressed in the review of literature. So next slide is about the objectives. Next slide. Next slide, please, Lavanya. So under objectives, so as I mentioned, we can frame objective or we can frame a title from the objective. So that's why I was telling that title we can frame at the last, at the end of synopsis preparation. We'll get a good title for the entire work, right? So objectives means illustration of the objectives of the present study. It should be recommended. So for confirmatory experiments, some specific hypothesis and clearly defined primary outcome measures are essentials. Like your PICO, I told no in the title. So it that is present in your hypothesis, and it should be uh, following this following criteria. Like it should be a specific objective, should be specific. Aim can be very vast thing. So out of in synopsis writing, you can see that one aim should be there. So aim most probably from the title itself we can frame a what aim. Suppose what I mentioned earlier, effectiveness of homeopathic medicine in the treatment of simple myopia, that is a title. So aim means we can frame aim out of this title as follows, like assess, okay, or to know the effectiveness of, okay, like that. So one verb you have to add in front. So to know the or to study the effectiveness of, okay, to study the effectiveness of, or to find out the effectiveness of homeopathic medicine. So like that we can edit the title and we can frame an aim, okay. But objective means it is a secondary aim actually. So the minute specific details should be there in the objective. So out of this title you can frame objective like which medicine is more effective, and which potency is more effective. All those things you can earn, which sex is more affected. So these things you can mention under the objective, and the time duration taken for getting ameliorated in each group you can take as an objective. So it should be specific and it should be measurable also. So we are measuring, that's why some objective parameters we are keeping as assessment criteria, like parameters like visual acuity in case of myopia. So it is measurable, no, visual acuity, as well as if you are keeping any serum level, maybe the serum ferritin, it's a measurable parameter. So we can study or to estimate the level of serum ferritin before and after the treatment. So that is a measurable parameter. Then it should be achievable. So don't set an ideal uh, objective. We have to set a real achievable parameter with the given time or duration of your study. So under materials and methods, we will give the details about the time duration of study. Duration of study may be 1 year, or if you are doing internship it should be 1 year. If you are doing STSH research it should be 6 months or 1 year. Or if you are doing a university it may be, so as per their guideline, their the time duration they mention. So that time duration, within that time duration we have to achieve that particular objective. So like that we have to set our objective, and it should be replicable. So replicable means if we are repeating the repeating the experiment also, we should get that particular result. So this is replicability is important for any research, and in the research should be, or in this particular objectives what we set for our study should be a replicable one, and it should be time bound. That's why time duration is very important. So within the given time duration we should able to achieve that particular objectives. So next is about materials and methods. Next slide. So under materials and methods, as a title indicates, we should mention, next slide please, we should mention about the materials what are required for the study as well as methods. Next slide. So under this, we have to mention about the source of data. So data collection is very, very important. Doctor, can you please move forward? Next slide. So yeah, let me continue. Source of data means from where you are collecting the data for your study. So if it is a clinical study, most probably we'll collect the data from the OP or IP, right? So from where the data will be collected, or from where the patients to be selected for your study. Maybe if you are doing a simple previous slide, if you are doing if you are doing a survey study, uh, maybe some prevalence study. Suppose you want to see the prevalence of some particular condition among one particular population in one particular place or a particular locality, right? So that you have to fix it. And what is the sample size, or how many people you are going to test this particular medicine, or how many people you are going to do the survey. So that is very important. Then inclusion and exclusion criteria. So inclusion and exclusion criteria, again, it will make our research more clear and more specific. So suppose if you are doing a clinical study, we have to suppose the simple myopia only will take. So inclusion criteria, what we can mention, no, suppose age group we mention in the title, 5 to 15 years of age group, right? That is the population. So in the inclusion, we'll write all sexes, all sex under all sexes between 5 and 15 years of age. So it is understood from this particular inclusion point, that is, we are taking the patients between 5 and 15 years of age group. Then there is no need to mention below 5 and above 15 is excluded under exclusion criteria. So most of the times, even in the good journals also, they are publishing articles with these kind of inclusion and exclusion criteria. So actually, that is a real concern for the real researchers. Why this common sense they are not using in while framing the inclusion and exclusion criteria. So if we are including the patients with the signs and symptoms of simple myopia, then there is no point in writing the exclusion criteria of the patients with the signs and symptoms or without any signs and symptoms of simple myopia. There is no point or no meaning in that. So it's already understood in inclusion criteria what are things we are including. And mainly exclusion criteria, we have to mention the pregnant ladies, lactating women, all those things. And if it is a pathologically advanced pathological myopia, we can exclude. That is possible, and that we can note under exclusion criteria. But what is written in exclusion criteria, don't repeat the same in any other style or form in exclusion criteria. So you have to be very careful. Don't repeat anything under exclusion. Then next is method of collection of data. So from the selected subject, so from the source of data, we know from where we are collecting the details, or from where we are selecting the patients, right? So from the patients, how we are collecting their information. So if it is a survey, how we are collecting? Maybe through the Google Forms, or maybe through the personal interviews, we are collecting the data. So that is a method of collection of data. So we have to completely define our primary and secondary outcome measures, like how we are collecting and why it is assessed, or why we are selecting this particular data, and when it will be assessed. The follow up, no, if we are giving a intervention, the follow up should be mentioned under that. So method of collection of data, suppose if a clinical study, during the first visit after case taking, we are giving the medicine, and after 1 month of time, we are following up the case, no. So all those things should be mentioned under method of collection of data. So including follow up, you can mention under that. And what all scales we are using for assessing the particular information of the patient. That is why it is important, means if you are getting a qualitative data, like the main example is pain is a qualitative data. We'll get whether pain is mild, moderate, severe, like that only, no. So this qualitative data, we can make it as a quantitative. We can give some scoring for this particular. So suppose if a scoring between 0 to 3 means it's mild, Then 3 to 6, it's moderate, and 6 to 10 is a severe. Like that, we are giving some scoring and some numbers. So like that, we can make a qualitative data or some sensation to a quantitative, like some numbering system we can give. So all these things are coming under method. Then next is recruitment. Recruitment means this follow-ups and the periods of recruitment and follow-up. We have to give this particular time, uh, what time for follow-up or reviewing. Okay, so suppose if your study total study duration is 1 year, then you can give follow-up every 1 month, or once in 3 months. Like that, you can give as per the prognosis of a disease. If it is a chronic disease, you can give that much time for the follow-up. So that is coming under this. So this is the next slide. Next slide, you can see one example for converting a qualitative data to a quantitative data. Next slide, please. So majority of the people are known to this particular scale, I think, that is VAS scale. Next slide, please. Next, the very next slide. You can see the VAS scale, that is visual analog scale. Yeah, visual analog scale means we'll call it as VAS in short. Okay, VAS. So it's a scale to see the changes in the severity of pain. So 0 to 10, that is the scoring. And as I said, no pain means 0, mild means 1 to 3, moderate means 4 to 6, and moderate to severe is 4 to 6, very severe is 7 to 9, and very worst pain possible, that is 10. So this is the visual. So you can give this, you can show this particular chart and this particular visual to the patient under study, and let them tell under which scale they are coming, or which expression they are having. No, so we can give some quantitative data to their pain. It's a qualitative sensation, right? So we can't, otherwise we can't compare the changes after the medicine. So like this, we can, with the help of some scales, some scoring system, we can convert the qualitative data to quantitative data. So next slide. Slide. So next is important, that is method of study. So we have to frame the study design. Next slide, please. Study design. So under the study design, we have to see whether it's a control study or whether it's a comparative study. See next slide, please. Hello. Could you please change? Yeah. Trials design means we have to design whether it's a comparative study or whether it is a controlled study. So including this particular allocation ratio, maybe we'll do a randomized control trial, or we'll do simple comparative study. So in your title, if you mention that design, no, it will be easier for the readers to find out the method of your study. Now you are doing a comparative study. Oh, okay, this research is about a RCT, or this research is about a comparison. Or with a single group also you can do single group non-controlled studies also possible, that is known as quasi experimental study. It's not like a true experimental study, it is quasi experimental. So in that there is no need to keep one control group, only one group study without control. And we can, like I mentioned, the simple myopia, that study can be considered as a quasi experimental study. It's a single group study. Okay, so implementation means who generate the random allocation sequence, and who enroll the participants, and who assign the participants to interventions. All these things should come under implementation. So first of all, under the method of study, we have to see whether it's a RCT, or whether it is a single arm study, double arm study, and 3 arm study. You know, you may be heard of this terminologies. So single arm study means only single group. Then two arm study means two groups will be there to compare, and three arm study means three groups will be there. It's like that. And how we are blinding the participants, like if you are blind, single blinded, double blinded study, all these things you may be knowing. So blinding, if you are doing blinding means who was blinded after assignment to intervention. Suppose the participants can be blinded, so participants may not be knowing under which group I am included, like whether it is experimental group or with a placebo or control group. So they may not be knowing this. Or we can give, or we can blind the care providers also, or we can blind the doctor or the physician himself or herself, or those who assessing the outcome also. And how we are blinding, that is also important. So this blinding is a good technique. So most of the times we are blinding the patients, right? We are blinding the patients, and they are randomly allocated to the groups for the experiments, right? So these are the things we have to be very careful while designing a study, and while drafting the methods as well as the materials of the study. So if it is possible, you should mention about the sampling technique. So if you are mentioning that 5 to 15 years of age group, if you are selecting, it's a purposely sampling. It's not a random sampling. Only this 5 to 15 years age group only you are selecting. So it's a purposely sampling. So it's a purposely sampling technique you have adopted, and you are blinding this particular participants, and you are comparing this interventional homeopathic treatment with a specific remedy. So this particular participants are not aware of which group they are included under. So we can blind the participant or the patients, right? So like this, you have to uh, give the details about what you are doing and how you are doing this. That's all about the method of study. And yeah, if we are mentioning the research question, next slide. Yes. So quality control means if you are giving importance to uh, all these factors, like training of the experimenter, then calibration of devices. Most of the times the device calibration we have to be very careful about it, and the supervision of co-workers, and information on how the experimenters will avoid the contamination of the substance and test systems. So if you are doing a experimental research, like if you are doing an in vitro study, suppose, or if you are checking the what suppose if you are checking one mother tincture preparation, and the medicine prepared from this same mother tincture, suppose. So you are preparing the mother tincture in your college laboratory, maybe pharmacy lab, or in your college premises. So you while preparing the mother tincture, you have to quantify the particular amount of plant part to be used as per our HPI, Pharmacopoeia of India, right? So we have to follow the instructions or protocols given in HPI, and all the safety measures as well as the quality measures we have to make clear while doing the experiments in the lab setup. So for taking the quantity required for preparing mother tincture, we have to weigh it in the weighing balance, right? So in that we have to see that whether this particular weigh balance is calibrated or not. So from that point onwards, we have to be very careful. Then while chopping this particular part, and while preparing this mother tincture by adding the particular proportionate alcohol, all those things we have to see to avoid the contamination. Okay, so it's very, very important while doing this kind of experimental research. The quality control is very important, and we have to give importance to that. And we have to make it serious, and we have to do accordingly as per the protocol or the instructions given in HPI or any standard methodology. If you are preparing homeopathic medicine, means you have to follow the HPI instructions. Or if you are doing any other kind of in vitro studies like antibacterial activity of our medicine, in vitro study. Some bacteria we'll take and we'll add our medicine and we'll see for the inhibition zone or the resistance for showing by this particular bacteria. So these things we have to follow any other protocol, no, that is published in any paper or any article. We can adopt the same protocol, maybe disk diffusion method they can use or some other methods they can use. So we have to follow any standard methodology. So that is very, very important. And while writing this final report, we should be very careful. Don't write like 2 to 3 drops. Whatever we have used, either 2 or 3, we have to write. Or else it will be like copy paste. Okay. So if you use 2 drops means you should write in the final reports, added 2 drops. Okay. So the small, little small mistakes can lead to the final rejection also. So statistical methods means we have to test the hypothesis. As I mentioned earlier, we have to test whether this null hypothesis is right or wrong, or alternate hypothesis is right or wrong. So for that, we have to use some test. As I mentioned in the simple myopia study, it's a single group study, right? So we are seeing the effectiveness of our medicine in the management of simple myopia. Simple myopia means a myopia which is not affected with the astigmatism. Usually you will get astigmatism along with the simple myopia or myopia. But very rarely, or it's not frequently, we are getting this simple myopia alone. So while doing the study, you can compare. Comparison is also possible in this study. How means we can compare the before and after and patient as a control. Here the patient is acting as a control and we are seeing that we are comparing the before and after value of some parameters like retinoscopic value or visual acuity or symptom score after our medicine, right? So here if the sample size is 30 and above means we can use periodicity test. So some statistical or statistics, biostatistics, we'll study in the MD syllabus. So who have done with MD, they may be knowing that we'll study about the research methodology and biostatistics. So in that we'll get some idea about what is t-test, what is student t-test, what is paid t-test, all these things we'll, and what is ANOVA. So for that, the students should get some guidance from the guide himself or herself, or else they can get help of any expert or any statistician also. That is also possible. Maybe some institutions are having their biostatisticians, or they can, or PG institutions definitely will be having statistician, so they can get help from the statistician. Okay, so statistical methods are used to compare the groups for the outcome. Okay, so for the symbol myopia, we can set a hypothesis like individualized homeopathic medicine is not effective in the management of simple myopia. That is a null hypothesis. So we have to test the hypothesis. Like how we'll test it? We'll record the before and after value of retinoscopic value, as well as before and after value of the symptom score, and before and after visual acuity values. All these three things, 3 parameters, if you are taking for analysis or assessment means, we'll make tables of this before after like that for these 3 parameters, and with some statistical tests, as I told, paired test we can use. So with some formula, some standard deviation we have to see, and all those things, formula is there, we have to substitute all those formula with values, then we'll get some p value, and we have to see the, we have to compare with the uh, table, and we'll get whether it is a significant change or it's not a significant change after the treatment. So like that we have to analyze. So during MD, we'll study all those things. For UG students, better to get guidance from your teachers only. Okay, that's my advice. So statistical methods we are using, and we are telling that this particular null hypothesis is rejected or accepted. Then we can find out the or we'll come to the conclusion. Okay, so next is about the bibliography. Next slide, please. Bibliography or reference. So referencing should be in the Vancouver style. Next slide. Next slide, please. Next slide. Hello, next slide. So referencing should be in the Vancouver style. So you may be knowing about this. You are familiar with this Vancouver styling and all. So nowadays it's very easy. We can generate the Vancouver style of bibliography in online. So this is some formats for Vancouver styling. Okay, this is a format for book references. Okay, book reference. So like this, we have to give Vancouver referencing. Next slides. Next slides. Next slides, please. Some examples are given in the coming slides. Yeah. Next. Next. So while giving reference, next slide, please. While giving references, you may be seen in that review of literature. If you are writing review of literature or if you are writing methodology, next slide, please. Methodology. In some dissertation or in any article published, you can see that some numbers are mentioned in the text. Okay, that is known as in-text citation. Next slide, please. Next, please. Next, yeah, some points are there. Yeah. So that is known as in-text citation. So in the text or content, you can see citation. So when you have to give citation means when your work is influenced by someone else's work. So now you are taking some points from any other published work. You can give citation. So next point, that is when you directly quote someone else's work. So this particular objective was tested in this particular study. If you are writing, so you have to give citation inside the content. Then if you are paraphrasing someone else's work, paraphrasing means you are not exactly copying those words, but you are changing, you are reframing the sentence and you are writing in your own ideas and words. That is known as paraphrasing. In another style, you are reframing the idea or content, right? So that is paraphrasing. So in these three situations, we have to give in text citation. So next point, you can move next. Yeah, next. So when you directly quote someone else's work as well as when you are paraphrasing someone else's work also, we can give in text citation. So next, please. So how you will how some rules are mentioned for giving that in text citation. That is, you can see some numbers are cited or some numbers are allocated to a source. Suppose if you are next, please. Yeah, next. So Arabic numerals like 1, 2, 3, we are using to give in text citation. So we are giving under the bibliography, we'll give, as I mentioned in the earlier slide, it is shown, no, referencing some references in Vancouver style. So it is serially numbered 1, 2, 3, 4 like that. So whatever you are given against the number 1, it should be there in the text also. So if you are getting or if you are taking a point from a source, from a resource or from an article, and you are naming it as one, and that one should be there in the text as well as it should be there in the referencing under the reference list. Okay, like that you have to number or you have to give the in text citation. See, for example, it should be given in a superscript. So next please, next. Superscript man, yeah, next please. Yeah, next. Yeah, superscript like this you can use this in text citation. So here is the 1 comma 3. So both 1 and 3 in the reference or bibliography, those two sources are taken for this particular topic. So that's why after a sentence, if you are doing like this inside, it means from this what reference 1 and 3 you have taken the single point that is meant for that. Got it? So superscript the number after the relevant part of the sentence or paragraph. So example, something dash was discovered, full stop, then you give superscription 1, 3. Suppose if you are taking from 1, 2, 3 means you can give 1 hyphen 3. Okay, so 1, 2, 3. 3 are included under this referencing. But if only 1, 3 means only first and third references which is mentioned under the reference list only considered for this particular point. Then reference numbers are generally placed outside the punctuation. That's why after full stop we have to give the reference numbers. So when multiple references are cited together means you can use this hyphen as I mentioned 4 to 7, then comma 14, 19. Okay, then you can use comma also. That's why 4 to 7 means it includes 4, 5, 6, 7. These four references are included. Then again 14 also you have taken for the particular point and 19 also you have taken. That's why we have used comma. So here in the text you can see that which is highlighted with yellow. During the past 50 years, full stop then superscription 2 means we can search the reference number 2 in the reference list, right? Then you can get the source from where this particular author got this particular point that is mentioned under the reference list. And you can see here 8 comma 9, then 10, 11, 12, 6 comma last reference is also included, then 12, 13, 14, 15 all are included, comma 12 to 15. So this is the way to give in text citations. In text citations. Okay. So this next slide. Next slide, please. And nowadays we'll get whatever style we are. APA style is there, Vancouver style is there for referencing. So whatever it is, if we are using online platform, we can generate online. So there is no manual labor is not required actually. So but these are the details required for books. So we have to fill the fields which is required for the books even if we are doing it online also. So author name we should add, title, edition, then place of publication, publisher name, year of publication, and page number, from which page number we have taken this particular data. Then next slide, that is required for journal. So if it is online journal also, we can add the URL or DOI, and we can fill the fields and get the generated Vancouver style reference. Next slide, please. Next slide. Yeah, next slide. Then details required for the website or web page. Again, we should get the author details, title, and available from URL and date of access. All those things are required for a website referencing. Okay, example is also given. So available at with URL. Next slide. So we can cite any style of referencing with the help of this website. Next, please. www.citethis4me.com. Next, please. So with the help of this particular website, we can cite any journal or any textbook or any website. Yeah, this is the website for citing your citing any research paper. Okay, as per the type of the material, make a citation. Next, please. Next, please. Yeah, some ethical issues. So while preparing synopsis, we should consider the possible ethical issues while presenting the synopsis also. So if you are dealing with this, next please, clinical studies, we should see the autonomy of the patient. That means we have to get the consent. Yeah, we have to get the consent from the adult, as well as if it is a child, we have to get consent or assent from a child. For child, parental consent is also mandatory. Next. So autonomy of the patient, we have to give respect to the autonomy. So that's why we have to get the informed consent from the patient. So as per the ICMR guidelines, you can download it from ICMR site also. This patient information sheet as well as consent form is there. So as per that format, we have to get the consent from each participant when we are conducting a human clinical study. And if it is animal study, means we have to present it in front of the animal ethics committee, and we have to get their consent, their permission also. And if it is a placebo control study, and we have to see placebo control study as we are denying the treatment to the particular patient group, that's why it is not recommended nowadays. But as I told earlier, as per the disease prognosis, we can consider placebo also. Then we have to avoid the vulnerable population, like lactating pregnant women. We usually will not add these people into the experimental group. If it is what if the patient is a pregnant woman, or if it is a lactating woman, we should avoid those people from the study. And only for lactating women related study and pregnant women related study, we can add them. Otherwise, we have to exclude this population from our study. Okay, so this is all about our today's topic: how to frame a synopsis and what all content should be there, and how to cite or how to generate this citation. So I hope you got some idea about the preliminary steps to write a synopsis. Thank you. So if any queries are there, you are all welcome. You can ask any queries are there. Hello. Hello, Dr. Lavanya. Queries are there, you can ask. Let's over to the coordinators, please.
I hope all have cleared their doubts, ma'am. I think thank you all. Thank you so much. Thank you, ma'am. Thank you so much for the wonderful session. Thank you, participants. Good night. Thank you.
Okay, thank you. Yeah.
Thank you.